Hi, I'm Kevin Luters with Bell Medical, and I'm excited to show you the Insight Airway Management System. And today we're going to talk about the pediatric scope and the infant scope. The Insight system is composed of three different components. We have the rigid stylet, or rigid lighted stylet, a video laryngoscope that has four different size blades, a MAC 1, 2, 3, and 4, and then we have four different sized flexible endoscopes. And today, like I said, we're going to talk about the pediatric scope and the infant scope. The infant scope is a 2.8 millimeter scope, and we're going to show you an example of doing an intubation. I have a 4.5 laryngoscope or endotracheal tube that I'm going to intubate this mannequin head. The flexible scope uses a digital camera at the end, and it is articulating, and it basically doesn't use fiber optics, so you can be a little bit more aggressive and don't have to worry as much as the fragility of the device. So once again, this is a 2.8 millimeter scope, and we're going to preload a endotracheal tube. This is a 4.5 endotracheal tube that goes easily over the 2.8, and I'm going to use a breakaway airway, put that into my mannequin, and now I'm going to basically go down the airway, and up is down and down is up. There I can see the vocal cords off in the distance. I'm going to move a little bit closer to them, and hopefully you can see that on my display and on the other remote display. And now I'm going to advance past the vocal cords, and you can see the tracheal rings, and I could go down as far as the carina if I wanted, but we're far enough down. Now I'm going to railroad the endotracheal tube over the flexible endoscope, and if I pull it back just a tad, I'll be able to see the endotracheal tube go over the display. So now I'm going to put my display away, and if I wanted to remove this airway, I would then just break it away from the endotracheal tube and pull it out, and it comes out easily, and I'm intubated into my trachea. That's the infant scope, flexible scope from Insight and from Bell Medical. Thank you.